Hello, executive management team. I just want to show my appreciation for giving me the time to present and discuss a failed merger between Marshfield and Gundersen Health Systems. Not only will we discuss the merger, but we will also look at how Marshfield can become more competitive as an independent. But first, to better understand the failed merger, I will provide some background and historical information of each facility before using the Porter model to analyze Marshfield's role in the failed merger. The Marshfield Clinic prides themselves on being able to treat many different diseases and disorders at an affordable price. Marshfield offers several specialties, including but not limited to anesthesia, ear, nose, and throat, and pulmonary medicine. Offering specialties and subspecialties throughout rural Wisconsin provides a sense of comfort throughout the community, knowing there are options available for quality care. Gundersen serves populations in Wisconsin, Minnesota, and Iowa that aims to be an outstanding teaching hospital that treats many different ailments for its patients. Gundersen consistently provides high-quality care at a low rate. Due to the fact of Marshfield's competitors partnering together, it caused the consumers to have a high bargaining power, which forced Marshfield to look at ways to leverage that consumer power back down. Two ways they leveraged that power was by implementing a telehealth network through remote areas of Wisconsin and by investing in electronic tools to improve workflow and promote quality improvement. Marshfield turned to supply chain management to aid in reduction of waste and to ensure that expenses are controlled. Marshfield will also purchase products in bulk from primary medical and surgery suppliers, which helps keep supplier competition high and positively affects Marshfield's bottom line. By incorporating specialty clinics, it makes the barriers to entry more difficult, and with it being a more rural area, Marshfield Clinic is within a more consolidated healthcare market. By providing an insurance market to customers, and specialty clinics has ensured that Marshfield Clinic is covering the health needs of its customers. Marshfield Clinic has been able to mitigate threats from substitutes by innovating and keeping current with new technology and services. By offering services differing from the competition and more advanced, it can prevent a customer from switching health systems or services. For example, offering telehealth, virtual visits, and specialty services through expansion and innovation allows Marshfield to increase the quality of care as well as lowering traditional hospital services. Due to the competitive nature of each health system listed in the financial losses that Marshfield Clinic suffered, it forced them to look at a possible merger with a rival to help manage the disruption in the industry. When these healthcare organizations partnered together, it did no favors for Marshfield and even added to the disruption. One of the most important issues of the merger was that of increased overall costs that are commonly associated with a merger. Another reason is how Gundersen would have to take on a reported $84 million in operating losses and an even larger net loss of $66.6 million. The next aspect of the merger that was unsuccessful was due to predicted increase in costs for staff and supplies, which is what majority of CEOs think about as a financial challenge. The last reason is the power struggle or hierarchy challenge to determine who gets what position and why. The recommendations for Marshall moving forward are some ways they can become more competitive and help business moving forward in the future. The first one being blockchain. Marshfield could use blockchain implementation to improve the relationship between payers and providers by ensuring the safety of personal health records while also giving access to essential medical staff. By making use of blockchain, it eliminates the third-party insurers, which can also significantly reduce transaction costs in return, which helps improve the bottom line. The next one is private equity investors. With the capital to improve using private equity investors, it allows a company like Marshfield to continue sustainable growth in a positive direction. Marshfield could utilize its equity investors both as a source of expansion capital and as a potential owner of a local competition. The last one being Veterans Community Care Program. In June 2019, the VA launched a Veterans Community Care Program which allows veterans more options to health care. Marshfield could utilize this opportunity as a position of expansion that includes more options for more patients of differing backgrounds. This would be a great basis for Marshfield to improve their market. When looking at a merger, one must analyze the business as an independent and as a joint health system by looking at a multitude of different factors. Before one comes to a decision, one must weigh the overwhelming factors and the standout benefit to make sure the juice is worth the squeeze. If any questions arise, my email is burnsblevin@yahoo.com. And again, thank you for giving me the time and cooperation to present this merger to you.